One of the concerns that patients have that are motivated to have comprehensive dentistry done is the cost. And it is a realistic concern. We find that when patients come to see us, there's really three obstacles that keep them from having the dentistry they want. One is certainly time. They're concerned about time if there's a lot of dentistry to do. One is fear. There's a lot of people that have stayed away from the dentist and gotten into problems because of horrible childhood experiences. And again, just afraid to deal with them. And of course, the third one in this economic time is prevalent is the cost. And I want to be clear that the last thing that we want to do in this practice is create more problems in somebody's life than the ones they have in their mouth because of money. The most important thing that we need to do for all our patients is to first establish what the treatment plan is, and that is done through a comprehensive exam, a consultation where we get very clear on what your dental goals are, and then some time that we would take away from you to figure out the best course of treatment. What's great about dentistry today is that we can often sacrifice on the time it takes to get the work done rather than the quality of care. And so it's very, very rare that I find a patient where we can't create a treatment plan where we will do it in phases. So once we establish what your budget is and what is going to fit into your life, maybe we work a little bit with your dental insurance, but primarily because dental insurance does have a ceiling and is limited, we often have to figure out what's going to be the number that you can work with on a yearly basis. And so even in a situation where somebody needs a full mouth reconstruction, we can often figure a way that we do it over a 3 or 4 year period and figure out what we need to do first, what we need to do second, what we do third, and get very clear on the path. And so that as we sit down, we can then arrange the appointments for you that are going to be the most organized, that we can get the maximum amount of work done in a short period of time. And then also, of course, make sure that that treatment is within the confines of your budget. So with that, the last thing I want to say to you is that a lot of patients feel like that economic concerns are only affecting them, and they may even be a little bit embarrassed to bring it up, but it's something that we need to discuss. And believe me, particularly in this economic time, it's a discussion that I have just about every day. And I guess one of the things that makes me feel very good about the training we've had and that the philosophy that we practice dentistry is that actually being able to do comprehensive care dentistry and to phase it in a way that fits a patient budget, and learning how to do that has really made me a better dentist. And it's also allowed me to extend the quality of care that we deliver to more people. And that's what makes me happy and excited. So with that, when you come to see us and you've got economic concerns, let's bring it up, let's talk about it very early. The sooner I know what I have to deal with, and I can be thinking about the best way to phase the dentistry that you want and need in a way that's going to be comfortable for you.